Bismillahirrahmanirrahim. Metabolic and nutritional disorders. First, amyloidosis, mucinosis, lipoproteinosis, hyalinosis cutis A mucosa, cutaneous calcification or calcinosis cutis, porphyria, and manifestations of nutritional deficiency. So the metabolic and nutritional disorders, amyloidosis, mucinosis, lipoproteinosis, and cutaneous calcification, porphyria, manifestations of nutritional deficiency. Cutaneous mucinosis. We start with cutaneous mucinosis. Cutaneous mucinosis is a heterogeneous group of disorders characterized by increased mucin, hyaluronic acid production, and dermal deposition. So it is a heterogeneous group of disorders characterized by increased mucin, hyaluronic acid production, and dermal deposition. Mucin is acid mucopolysaccharide, especially hyaluronic acid and heparin and chondroitin sulfate. Glycoprotein in germs that is made by fibroblasts, and a large amount of water is lost with dehydration of specimen, leading to basophilic threads and granules in hematoxylin and eosine. So staining of cutaneous mucin with colloidal iron, blue-green, Alcian blue, positive at pH 2.5 but negative at pH 0.5, Tolidine blue, metachromasia at pH 7 and 4 but not less than 2, and PAS negative due to absence of neutral mucopolysaccharide. So the cutaneous mucinosis is a heterogeneous group of disorders characterized by increased mucin production and dermal deposition. Mucin is acid mucopolysaccharide, especially hyaluronic acid, heparin, and chondroitin sulfate. The glycoprotein in germs is made by fibroblasts, and large amount of water is lost during dehydration of specimen, leaving basophilic threads and granules in hematoxylin and eosine. Staining of cutaneous mucin, colloidal iron, blue-green, Alcian blue, positive at pH 2.5 but negative at pH 0.5, Tolidine blue, metachromasia, pH 7 and 4 but not less than 2, PAS negative due to absence of neutral mucopolysaccharide. Classification of cutaneous mucinosis. Cutaneous mucinosis is classified into localized, follicular, and generalized types. So the mucinosis, localized, follicular, and generalized. We'll start on the follicular. Follicular, acute benign and chronic benign, and lymphoma associated. Follicular, acute benign, chronic benign, and lymphoma associated. Generalized myxedema and pretibial myxedema, scleroderma adultorum of Buschke, reticular erythematous mucinosis, and scleromyxedema. Generalized, there is generalized myxedema and pretibial myxedema in Graves' disease, and there is scleroderma adultorum of Buschke and scleromyxedema and reticular erythematous mucinosis. The localized types are papular mucinosis, nodular mucinosis, atypical mucinosis. Papular mucinosis, and also there is myxoid cysts. Papular mucinosis, like in myxedomatosis, and there is discrete papular mucinosis, self-healing papular mucinosis, acral persistent papular mucinosis, and papular mucinosis of infancy. These are all papular mucinosis. Papular mucinosis like in myxedematosis, discrete papular mucinosis, self-healing papular mucinosis, acral persistent papular mucinosis, and papular mucinosis of infancy. There is the nodular mucinosis, and there is atypical types like scleroderma, like systemic symptoms, and with paraproteinemia and cutaneous focal mucinosis. So this is an introduction of the cutaneous mucinosis, heterogeneous group of disorders characterized by increased mucin production and dermal deposition, composed of acid mucopolysaccharide, hyaluronic acid, heparin, and chondroitin sulfate, and also the staining of mucin with hematoxylin and eosine. There is the glycoprotein in germs lose large amount of water, leading to basophilic threads and granules and H&E, and the staining with colloidal iron, blue-green, ancient blue, positive at pH 2.5, negative at pH 0.5, toluidine blue, metachromasia at pH 7 and 4 but not less than 2, PAS negative due to absence of natural or neutral mucopolysaccharide. And there is the classification, the general classification of mucinosis. There is localized, follicular, and generalized. The localized are papular mucinosis and myxoid cyst, papular mucinosis like myxonomatosis, discrete papular mucinosis, self-healing papular mucinosis, acral persistent papular mucinosis of infancy, nodular mucinosis, atypical types like scleroderma like systemic symptoms, paraproteinemia, cutaneous focal mucinosis. For the follicular mucinosis, there is acute benign, chronic benign, and lymphoma associated. There is generalized types of mucinosis, which are generalized myxedema and pretibial myxedema and Graves' disease, sclerodema adultorum of Buschke, scleromyxedema, and reticular erythematous mucinosis. Sclerodema adultorum of Buschke. Sclerodema adultorum of Buschke. Sclerodema adultorum of Buschke, it is rapidly progressive, diffuse, non-pitting edema and hardening of the skin. Rapidly progressive, diffuse, non-pitting edema and hardening of the skin. Clinical picture, there is, as we said, rapidly progressive, diffuse, non-pitting edema and hardening of the skin of the face, and then it progressed to the and extend to the neck, and then to the trunk, and then to the proximal extremities. It is, he cannot smile, he has corrugation in his face, and there is difficulty of tongue protrusion, and the similarities to and differences to scleroderma is there is no hand and feet, unlike sclerodema and like eosinophilic fasciitis, and there is no Raynaud's phenomena, and there is no or rare esophagus. It is like scleroderma in affection of the tongue. Sometimes rarely affected the esophagus and skeletal muscle, but the esophagus, if affected, it doesn't affect the lower part like the scleroderma, but it affects only the upper part. So, sclerodema adultorum of Buschke, rapidly progressive, diffuse, non-pitting edema and hardening of the skin. مش ممكن يتقلبص. It's وناشفة قوي. It occurs in the face and then extends to the neck, trunk, and proximal extremities. There is no hand and feet, spares hand and feet, and no Raynaud's phenomena, and no esophagus or rarely esophagus. If happens, يبقى to the upper esophagus rarely, and also there is affection of the trunk. There are mainly two types, idiopathic type and diabetes associated type, or scleroderma adultorum diabeticorum, diabetes associated insulin dependent diabetes mellitus. So the idiopathic type of sclerodema adultorum of Buschke, the idiopathic part or type is occurs in childhood or adolescence, usually from 6 to 12 years, follows streptococcal infection, and there is complete resolution after 6 to 12 months. But the diabetes associated insulin dependent diabetes, it may persist. And biopsy taken, there is accumulation of acid mucopolysaccharides, mainly hyaluronic acid, in the derms and subcutaneous tissue, separating swollen collagen bundles. As we can see, the diagram, there is accumulation of acid mucopolysaccharides, mainly hyaluronic acid, in the derms and subcutaneous tissue, and separating the swollen collagen bundles. There is systemic manifestations of sclerodema adultorum of Buschke. The systemic manifestations are ECG abnormalities, pleural and pericardial and peritoneal effusion, carpal tunnel syndrome, proximal muscle weakness. ECG abnormalities, pleural, pericardial, peritoneal effusion, carpal tunnel syndrome, proximal muscle weakness. If we make an investigations, it is from the clinical picture. So there is that idiopathic part due to streptococcal infection. So we can do throat swab for streptococcal infection, and for diabetes we make fasting blood sugar, and also we can do skin biopsy. Also there is serum protein electrophoresis to exclude monoclonal gammopathy, paraproteinemia or myeloma. So this is the investigations in the red color, and the treatment is penicillin or broad spectrum antibiotic, melphalan, cyclosporin, systemic steroid, PUVA and electron beam. Penicillin, broad spectrum antibiotic, melphalan, cyclosporin, systemic steroid, PUVA and electron beam. So this is the scleroderma adultorum of Buschke. Scleroderma adultorum of Buschke is a rapidly progressive diffuse non-pitting edema and hardening of the skin that occurs on the face, start on the face, extend to the neck, trunk and proximal extremities. Unlike scleroderma, it doesn't affect the hand and feet, no Raynaud's phenomena, no esophagus or rarely esophagus, if occurs to the upper part only. And also, but it is like scleroderma in affecting the tongue. Also rarely skeletal muscles. Two types: idiopathic type in childhood or adolescence, follows streptococcal infection, complete resolution after 6 to 12 months. Diabetes associated insulin dependence diabetes, this may persist. And for the histopathology or by the biopsy, there is accumulation of acid mucopolysaccharide, hyaluronic acid in derms and subcutaneous tissue, separating swollen collagen bundles. The systemic manifestations of scleroderma adultorum of Buschke: ECG abnormalities, pleural and pericardial peritoneal effusion, carpal tunnel syndrome, proximal muscle weakness. The treatment by penicillin or broad-spectrum antibiotic according to type, melphalan, cyclosporin, systemic steroid, PUVA and electron beam. This is the scleroderma adultorum of Buschke. Scleroderma adultorum of Buschke. This is the clinical picture of scleroderma adultorum affecting the neck and back. And this is the histopathology: edematous papillary layer, thick derms and large collagen bundles separated by interfascicular spaces. And also, as we can see here, this is a scan from the back comparing to the normal control. As we said, the histopathology, there is accumulation of acid mucopolysaccharide, hyaluronic acid in derms and subcutaneous tissue, separating swollen collagen bundles. You can see here, this is scleroderma adultorum, low magnification, thick collagen and clefts between collagen bundles, pigmented epidermis. And here we can see the high magnification, the thick collagen and clefts between collagen bundles. And also we can see here the colloidal iron stain for mucin. This is the blue mucin and the thick collagen bundles. So the first generalized type of cutaneous mucinosis is scleroderma adultorum of Buschke. Scleroderma adultorum of Buschke. The second type of the generalized mucinosis or cutaneous mucinosis is reticular erythematous mucinosis, plaque-like mucinosis. Reticular erythematous mucinosis or plaque-like mucinosis. The reticular erythematous mucinosis clinical picture, from its name, it's reticular and erythematous. Okay, so it is reticular and erythematous in the middle of the chest and upper back. It's irregular but well-defined edge. So irregular but well-defined edge, reticular and erythematous area. So there in the middle of the chest and upper back, and ultraviolet ray exacerbations of the condition. The histopathology is there is the mucin deposition between collagen bundles, and there is perivascular mononuclear infiltrate and vascular dilatation. So, like other mucinosis, there is mucin depositions between the collagen bundles, and there is additionally there is the mononuclear infiltrate around vascular dilatations, and the treatment is anti-malarial like chloroquine. Some use lasers also. So the reticular erythematous mucinosis, plaque-like mucinosis, clinical picture, from its name, it's a reticular erythematous area which is irregular but well-defined edge, in the middle of the chest and upper back, ultraviolet ray exacerbations, and the histopathology, there is mucin deposition between collagen bundles, and there is mononuclear infiltrate and vascular dilatation. Treatment antimalarial like chloroquine. We have here some nice pictures I took from the Google of the reticular erythematous mucinosis, clinically and histopathology. And here also we see the reticular erythematous mucinosis with low magnification, that we can see the mucin here, and also we can see the perivascular lymphocytes. Histopathology of reticular erythematous mucinosis. There is mucin between collagen bundles, and there is perivascular lymphocytes, mononuclear infiltrate of around the vascular endothelium. Third type of the generalized cutaneous mucinosis is scleromyxedema. The scleromyxedema, it is mostly in the face and arms. حبوب محببة, exaggeration of skin markings. There are three types: the lichenoid papules, or the papular mucinosis, small skin colored with tendency to linear arrangement, and there is another type, diffuse thickening and erythema of the skin, elephant type, with exaggeration of facial ridges and plus or minus limitation of flexion of fingers. And sometimes there is a scleroderma-like picture, but the presence of lichenoid papules differentiated from scleroderma. So the scleromyxedema occurs mostly in the face and arms. There are three types: lichenoid papules or papular mucinosis, which can happen alone and is regarded as one of the localized types if it happens alone, but it could be part of the scleromyxedema. The lichenoid papules, small skin colored with tendency to linear arrangement, and there is the diffuse thickening of the skin, the elephant type, with exaggeration of facial ridges and limitation of flexion of fingers, and there is the scleroderma-like picture, but there is lichenoid papules which differentiated from the scleroderma. As we can see here, this is the papular mucinosis. There is the papules of the forehead and longitudinal folding of the glabella, and this is the diffuse part, diffuse skin induration and erythema involving chest, arms, and dorsum of the hand. And of course the third type is the scleroderma-like picture, but with lichenoid papules. So this is the scleromyxedema. The pathogenesis of scleromyxedema, it is serum paraproteinemia. There is serum paraproteinemia always present. It's a gammopathy of immunoglobulin G with lambda light chain. Unlike multiple myeloma, it's kappa light chain. The plasmacytosis in bone marrow is responsible for this gammopathy. Gammopathy of immunoglobulin G leads to increased fibroblast activity that stimulate mucopolysaccharide synthesis. So the pathogenesis of scleromyxedema is serum paraproteinemia, always present. It's a gammopathy of immunoglobulin G with lambda light chain, unlike multiple myeloma, which is kappa light chain. And there is plasmacytosis that is responsible for this gammopathy of immunoglobulin G, leads to fibroblast activity. So the serum paraproteinemia, always present. It's gammopathy of immunoglobulin G with lambda light chain, unlike multiple myeloma with kappa light chain. There is plasmacytosis responsible for this gammopathy of immunoglobulin G, leading to increased fibroblast activity and accumulation of mucopolysaccharides synthesis. The histopathology is mucinous deposits in the middle and deep derms, which split collagen bundles into loose fibrous network. Mucin deposits in the middle and deep derms with split collagen bundles into loose fibrous network. As we can see here, the mucin and numerous plump fibroblasts, and this is in Alcian blue pH 2.5, as we said before, not 0.5 but 2.5. And here also the, as we said, this scleroderma, mucin deposits in the middle and deep derms, and split the collagen bundles into loose fibrous network. numerous mucinous deposits in the middle and deep derms, which split the collagen bundles into loose fibrous network. Now for the treatment, there is cytotoxic drug, melphalan, cyclosporin, and steroids and isotretinoin, also PUVA, electron beam, X-ray, extracorporeal photochemotherapy, and plasmapheresis, and the systemic manifestations like scleroderma, dysphagia, hoarseness of voice, regurgitation, arthropathy, and muscle weakness. And also there is CNS manifestations like scleromyxedema, encephalopathy, coma, psychosis, seizures, and fatigue and weakness. Systemic manifestations similar to scleroderma like dysphagia, hoarseness of voice, regurgitation, arthropathy, muscle weakness, and scleromyxedema, encephalopathy, coma, psychosis, seizures, and fatigue and weakness. So this is the scleromyxedema clinical picture, pathogenesis, histopathology, and treatment, and also the systemic manifestations. Other types of generalized mucinosis: generalized myxedema in hypothyroidism and pretibial myxedema in hyperthyroidism or Graves' disease. First, the generalized myxedema in hypothyroidism. Due to inadequate thyroid function, dermal accumulation of acid mucopolysaccharide, especially hyaluronic and chondroitin sulfate, which bind to water into tissues, leading to puffness of the skin. The skin in general, it is dry, coarse, and there is also the scalp hair is dry and coarse and sparse scalp hair, plus or minus alopecia. And there is the face is swollen, puffness of eyelids, and the skin is brittle and striated nails, and skin is pale and yellowish skin due to secondary carotenemia and xerosis creatoderma. The whole skin is dry, pale, waxy, puffy, but not pitting, especially distal part of the extremities. The diagnosis: decreased protein-bound iodine and decreased T3 and T4. TSH in the primary type, increased TSH, and in the pituitary failure there is decreased TSH. The treatment is thyroid replacement therapy. So the generalized myxedema in hypothyroidism, it is due to inadequate thyroid function, leading to dermal accumulation of acid mucopolysaccharide, especially hyaluronic and chondroitin sulfate, which bind water into tissues, leading to puffness of the skin. There is dry, coarse, sparse scalp hair and plus or minus alopecia. Face is swollen with puffness of eyelids. The skin is yellow and pale yellowish skin due to secondary carotenemia, xerosis keratoderma, brittle striated nails, and dry, pale, waxy, puffy skin, but not pitting due to especially distal parts of the extremities. The diagnosis: decreased protein-bound iodine, T3 and T4. The TSH is either elevated in the primary type or decreased in the pituitary failure. Treatment: thyroid replacement therapy. As we can see here, this is the hypothyroidism patient. It is cold, dry, pale skin, absence of hair in the lateral third of the eyebrow, and puffness of the face and lips due to accumulation of water and mucopolysaccharide in derms. The hair is dry, coarse, and brittle. The nose is broadened. Tongue is large, smooth, red, and clumsy. There is a drooping of the eyelids. The face lacks expression and most pathognomonic of any of the features. This is the generalized myxedema in the hypothyroidism. The other type is the pretibial myxedema. The pretibial myxedema, it occurs in Graves' disease. It's a part of Graves' disease. It's 7 times more in females. Of course, the Graves' disease has 3 things: the exophthalmos, the diffuse thyroid enlargement, and the thyroid acropathy. It's clubbing of fingers and toes, preosteal new bone formation of the phalanges and other distal long bones. And there is the pretibial myxedema, which we're talking about, which occurs sometimes only after treatment. So the Graves' disease is composed of exophthalmos, diffuse thyroid enlargement, thyroid acropathy, clubbing of fingers and toes, preosteal newborn formation of the phalanges and other distal long bones, and there is the pretibial myxedema, which we'll talk about. The clinical picture of pretibial myxedema is: there is sharply circumscribed nodules or plaques, which are yellow, brown, waxy plaques and nodules, with prominent hair follicles leading to pedorange appearance. And there is diffuse non-pitting edema or elephantiatic lesions, which may be the presenting symptom. It occurs on the anterior aspect of the leg but may extend to the lower abdomen or to the dorsum of the feet. There is also localized hypertrichosis may occur. So the pretibial myxedema clinical picture: sharply circumscribed, yellow-brown waxy nodules or plaques with prominent hair follicles giving pedorange appearance over the anterior aspect of the leg. And there is diffuse non-pitting edema elephantiatic lesions, maybe the presenting clinical picture. It occurs over the anterior aspect of the leg but can extend to lower abdomen or the dorsum of the feet, and there is localized hypertrichosis may occur. The histopathology: there is large amount of mucins in the mid-derms separating collagen bundles and individual collagen fibers. في بطش الميوسين في mid-derms. Also, there is empty spaces due to shrinkage of mucin in fixation and dryness. So there is large amount of mucin in the mid-derms separating collagen bundles and individual collagen fibers. And as we can see here, this is the histopathology of pretibial myxedema, the mucin and the fibroblasts, and here also there is lymphocytes. And this is colloidal iron stain of mucin. We can see the blue mucin of pretibial myxedema. So this is the histopathology, which is large amount of mucin in the mid-derms, separating collagen bundles and individual collagen fibers. And there is empty spaces due to shrinkage of mucin in infixation and dryness. The pathogenesis: LATs or long-acting thyroid stimulator. It's 50% of cases. It's a circulating immunoglobulin G, correlate highly with presence of pretibial myxedema. So the pathogenesis is long-acting thyroid stimulating, which is circulating immunoglobulin G, correlate highly with presence of pretibial myxedema. The treatment is corticosteroid under occlusion or intradermal or surgery. So we give corticosteroids under occlusion or intralesional corticosteroids or surgery. There is a question here that why lesion of pretibial myxedema is localized to pretibial lesion. They found that there is a factor in the serum of pretibial myxedema patient, which in tissue culture can increase 2 to 3 folds of hyaluronic acid production by fibroblasts from pretibial area but not from shoulder and prepuce. So this is the pretibial myxedema. The pretibial myxedema is a part of Graves' disease, which we said the exophthalmos and thyroid acropathy and the diffuse thyroid enlargement and pretibial myxedema. We can see here the pretibial myxedema clinical picture of pretibial myxedema. This is infiltrated plaque that is extend to the cuff and partially hyperkeratotic. There is also isolated nodule on the dorsum of the right foot. And this is the Graves' disease, which we can see. Proptosis, acropathy, pink skin color, papules and plaques and nodules of pretibial myxedema. And also, of course, there is thyroid enlargement. Now I remind you of the cutaneous mucinosis. There is 3 types: the generalized, follicular, and localized. We started with the generalized, okay, and we talked about the generalized type, which is scleridema adultorum of Buschke, reticular erythematous mucinosis, and scleromyxedema, and the generalized myxedema and pretibial myxedema. And these are the generalized types of the mucinosis: generalized myxedema, scleromyxedema, pretibial myxedema, and scleridema and reticular erythematous mucinosis. Before shifting to other types of mucinosis, we want to say a hint about, since we are talking about the scleridema adultorum of Buschke, the diabetic type, we will talk about the cutaneous manifestations of diabetes. The cutaneous manifestations of diabetes are many. There is the diabetic thick skin. The diabetic thick skin, like there is generalized thick skin, especially the back of the hands and fingers, and rough interphalangeal joints at the knuckles, Hunte's papules. Also, there is the scleroderma-like syndrome, and there is our sclerodema adultorum of Buschke. These three, diabetic thick skin, generalized thickness, scleroderma-like syndrome, and sclerodema adultorum of Buschke. Also, there is necrobiosis lipoidica diabeticorum, and there is granuloma annular, which is usually multiple in diabetes, and there is the diabetic dermopathy, pretibial pigmentation, which is multiple brown oval atrophic macules on the front and lateral of the shins, which is bilateral, and there is also the xanthomas, yellow skin, pigmented purpuric dermatosis, oral leukoplakia, oral lichen planus, and there is also diabetic bully, which is intraepidermal bully, diabetic bully, spontaneous, sudden, asymptomatic. It heals slowly with no scarring, and it occurs mainly on the hand and feet. Also, there is acquired perforating dermatosis. Infections, of course, like bacterial, fungal, bacterial pyoderma abscess like Staph aureus, otitis externa, Pseudomonas, and erythrasma. Fungal like Candida, and deep fungal mucormycosis, which is fatal in ketoacidosis. And there are also the complications, the cutaneous manifestations includes the complications of diabetes, like the microangiopathy, like diabetic foot, and macroangiopathy like atrophy, hair loss, nail dystrophy, and pallor. As we can see here, the microangiopathy causing diabetic foot, and the macroangiopathy like atrophy, hair loss, nail dystrophy, and pallor. Also the neuropathy, which causes neurotrophic ulcers and Charcot joint. These are complications of diabetes: microangiopathy, diabetic foot, macroangiopathy, atrophy, hair loss, nail dystrophy, and pallor, and neuropathy, neurotrophic ulcers, and Charcot joint. There's also the cutaneous manifestations of treatment of diabetes, like oral hypoglycemics, maculopapular, photoallergic, phototoxic, and treatment like insulin, especially animal source, and lipoatrophy. These are cutaneous manifestations of treatment of diabetes: oral hypoglycemics, maculopapular, photoallergic, phototoxic, insulin, animal source, lipoatrophy. So these are the complications of or cutaneous manifestations of diabetes. There is diabetic thick skin, generalized skin thickness, and rough interphalangeal joints, knuckles, Hunte's papules, also scleroderma-like syndrome, sclerodema adultorum of Buschke, necrobiosis lipoidica diabeticorum, multiple granuloma annular, pretibial pigmentation, which is the diabetic dermopathy, xanthomas, yellow skin, acanthosis nigricans, pigmented purpuric dermatosis, oral leukoplakia, oral lichen planus, diabetic bully, and acquired perforating dermatosis. Infections, bacterial, fungal, complications like micro and macroangiopathies and neuropathies, and also cutaneous manifestations of treatment of insulins, oral hypoglycemics, and insulin. Second type of follicular mucinosis mucinosis is the follicular mucinosis. We talked about the generalized mucinosis. Now we will talk about the follicular mucinosis. Follicular mucinosis or alopecia mucinosa, they are follicular papules with tendency to coalesce into one or several edematous, erythematous, scaly plaques. The plaques are devoid of hair, but alopecia is not always present, especially when only villous follicles are involved. So follicular mucinosis is a better name. Follicular mucinosis, they are follicular papules with tendency to coalesce into one or several edematous, erythematous, scaly plaques. Sometimes they are devoid of hair. There are two types of benign follicular mucinosis: acute benign and chronic benign, and there is also lymphoma associated with T-cell lymphoma. The acute benign, it occurs in younger patients, limited to the head and neck, 1 or 2 lesions, and spontaneous healing with months or years. The chronic benign occurs in older patients and more generalized, more numerous, soft gelatinous plaques or nodules. Mucin can be squeezed from the affected follicles. It persists for many years, but without any systemic or associated disease. The lymphoma associated occurs with T-cell lymphoma in elderly patients and lymphoma present from the onset of the disease. These are the 3 types of the follicular mucinosis: acute benign, chronic benign, lymphoma associated, acute benign in younger patient limited to the head and neck, 1 or 2 lesions, spontaneous healing, chronic benign, older patient, more generalized, more numerous, soft gelatinous papules or plaques that mucin can be squeezed from the affected follicles, persist for many years, but no associated disease, and lymphoma associated in elderly patients, lymphoma present from the start. The histopathology, there is mucinous changes in the outer root sheath and mixed inflammatory infiltrate with atypical lymphocytes with the infiltrate if the cutaneous T-cell lymphoma is present. Of course, in hematoxylin eosin, there is the hair follicle with the solution of follicular epithelium and cystic cavities, and discrete lymphocytic and eosinophilic intra and perifollicular infiltrate. Also, there is with the colloidal iron staining, there is mucin deposition within the hair follicle. So there is mucinous changes in the outer root sheath and sebaceous gland. This is giving the follicular dissolution and of follicular epithelium and cystic cavity. And there is also mixed inflammatory infiltrate, lymphocytic and eosinophilic, in intra and perifollicular infiltrate. If there is T-cell lymphoma, there is atypical lymphocytes. In colloidal iron staining, there is mucin deposition within the hair follicle. The treatment is steroid, topical, systemic, intralesional, PUVA, and if there is lymphoma associated, there is superficial radiotherapy. Some studies, there is the hypochloroquine treatment is recommended. So this is the follicular mucinosis, acute benign, chronic benign, and lymphoma associated. Here we see the alopecia mucinosa clinical picture and leading to hair loss. And here we can see the alopecia, the follicular mucinosis in cutaneous T-cell lymphoma. There is interesting pictures here from Google. We'll find here the histopathology. There is mucus changes in the outer root sheath and mixed inflammatory infiltrate. So there is the hair follicular dissolution of follicular epithelium and cystic cavities, as we can see, and there is discrete lymphocytic and eosinophilic intra and perifollicular infiltrate. Also, there is another picture. You can see here also this picture with the colloidal iron staining, and another one of the colloidal iron staining also with the blue color, mucin deposition in the hair follicle. There is interesting also clinical pictures. This is the localized part, the benign, the acute benign in the younger patient, which is more localized in the head and neck. And we see also here the histopathology. Another pictures of the alopecia mucinosa or follicular mucinosis. Here this picture is interesting. Of the alopecia mucinosa. And this is the chronic benign in older patients. This is more generalized and more numerous. Soft gelatinous plaques or nodules with mucin can be squeezed from the affected follicles that persist for many years, but there is no associated disease, as we can see here in this type of the chronic benign in older patients, and as we said in the acute benign, and there is the lymphoma associated. And this is the follicular mucinosis. Again, the classification of cutaneous mucinosis. We talked about the generalized causes, the follicular mucinosis, and now we will talk about the localized mucinosis. Also the myxoid cyst. So there is the papular mucinosis like in myxodermatosis, and the discrete papular mucinosis, the self-healing papular mucinosis, the acral persistent papular mucinosis, the papular mucinosis of infancy, and the nodular mucinosis, and atypical types like with scleroderma systemic symptoms, the paraproteinemia and cutaneous focal mucinosis. So these are the types of localized mucinosis. Now we will talk about them. The localized mucinosis, the discrete papular mucinosis, and down here there is the lichen myxodermatosis, which is could be a part of the scleromyxedema. The papular mucinosis or lichen myxodermatosis, there are numerous lichenoid papules which coalesce, forming plaques, leading to extensive thickening of the skin. Histologically, fibroblast proliferation, increased mucopolysaccharide deposition in the skin, as we talked about papular mucinosis, which could be a part of the lichen of the scleromyxedema, as we said before, and could be part of, if it occurs alone, it could be localized mucinosis, lichen myxodermatosis. Okay, this is the first type of the localized mucinosis. And then there is the papular mucinosis, the discrete papular mucinosis, the myxoid cyst, and the discrete papular mucinosis, firm waxy indurated papules that may coalesce into plaques in the extremities and trunk, erythematous yellow hue. So this is the discrete papular mucinosis, firm waxy indurated papules that may coalesce into plaques in the extremities and trunk, erythematous yellowish hue. Acral persistent papular mucinosis, it is acral, occurs in the dorsum of the hand, wrist, and distal forearm. Self-healing papular mucinosis, it occurs in adult, and there is juvenile type. Resolved within weeks and months in the face, scalp, abdomen, and thigh. There is fever, arthralgia, weakness, paraprotein, and thyroid dysfunction. This is the self-healing papular mucinosis, adult and juvenile, resolves within weeks or months, as it is self-healing, and it occurs in the face, scalp, abdomen, and thigh, and there is fever, arthralgia, and weakness. And there is paraproteinemia and thyroid dysfunction. There is the papular mucinosis of infancy, occurs in the elbow and trunk, and there is the nodular mucinosis, and there is atypical variants. The atypical variants with scleroderma-like systemic symptoms like dysphagia and hoarseness of voice, and with paraproteinemia and cutaneous focal mucinosis. These are the localized type of follicular mucinosis: papular mucinosis, discrete papular mucinosis, acral persistent, self-healing, papular mucinosis of infancy, nodular mucinosis, atypical variants. So the lichen myxodermatosis, as we said, there is numerous lichenoid papules that coalesce to plaques, excessive thickening of skin, and histopathology, fibroblast proliferation, increased mucopolysaccharide deposition in the skin, and the myxoid cyst, and the discrete papular mucinosis, firm, waxy, indurated papules that may coalesce into plaques in the extremities and trunk, erythematous yellowish hue, acral persistent, it is acral and persistent. It occurs in the hand and wrist and dorsum of the hand and wrist and distal forearm. The self-healing, it is self-healing, resolved within weeks and months, occur in adult, juvenile. Face, scalp, abdomen, and thigh. Fever, arthralgia, weakness, increased paraprotein and thyroid dysfunction. The papular mucinosis of infancy occurs in the elbow and trunk. The nodular mucinosis, the atypical variants with scleromyxedema-like systemic symptoms, dysphagia and hoarseness, with paraproteinemia, and cutaneous focal mucinosis. So this is the last time is the localized mucinosis. Here there is the interesting pictures also from Google. We can see in the myxoid cyst, pictures of myxoid cyst.